and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Dairy-based diet helps boost concentration, study finds. A recent randomized controlled crossover study in the Journal of Dairy Science published by Elsevier demonstrates that a dairy-based protein-rich breakfast not only keeps you fuller compared with a carbohydrate-rich meal or skipping breakfast entirely, it also helps boost concentration in the critical first hours of the day. Dr. Hansen, study's lead investigator, and her team set out a randomized trial following 30 young women for 3 test days, separated by at least 2 days. The day before each test, the women's physical activity levels and diets were standardized. The participants aged 18 to 30 had body mass index scores higher than 25, classifying them as overweight to obese. During the study, the participants either consumed a protein-rich breakfast of skyr yogurt and oats or a low-protein, high-carbohydrate meal of whole grain bread with raspberry jam and apple juice. Both meals had matching energy content and density and the same amount of dietary fiber and fat. The control group skipped breakfast entirely. Study highlights best practices in total knee replacement surgery. In an effort to understand which knee replacement surgery approach is better, researchers from Kyushu University collected convincing evidence in favor of preserving the patient's native alignment. The study was published in the Bone and Joint Journal. Neutral alignment is not always the patient's original alignment, and there is some debate within the orthopedic community on whether restoring the patient's original alignment can lead to better patient-reported outcomes. In the present study, researchers have attempted to settle this debate and create a comprehensive guide on preoperative planning and execution of knee replacement surgery. The study is mostly centered around a classification system called the coronal plane alignment of the knee. It categorizes the possible alignments of the knee joint based on 2 main characteristics, that is the hip-knee ankle angle and the angle of the joint line. Can fish oil supplements guard against risk of developing cancer? New research from the University of Georgia suggests omega-3 and omega-6 fatty acid may help ward off a variety of cancers. Higher omega-3 and omega-6 levels were associated with lower rates of cancer, said Yuchen Zhang, lead author of the study and a doctoral student in UGA's College of Public Health. Participants with high level of omega-3s had lower rates of colon, stomach and lung cancer in addition to lower rates of other digestive tract cancers. High omega-6 levels led to lower rates of 14 different cancers, including brain, malignant melanoma, bladder, and more. Mother's health struggles may pose a risk for her children. Women with polycystic ovary syndrome and obesity are at a higher risk of giving birth to smaller babies in terms of birth weight, length, and head circumference, according to a recent study conducted at the Norwegian University of Science and Technology. In the study, 390 children born to women with PCOS were compared to around 70,000 children from the Norwegian mother, father and child cohort study. The researchers found that on average, the babies born to mothers with PCOS weighed less, were shorter and had a smaller head circumference at birth. This was particularly the case when the mothers were obese, meaning they had a BMI over 30. In women of normal weight who have PCOS, we only find that their children have a lower birth weight compared to women who do not have PCOS. It is the group of children born to mothers with obesity that stands out the most. These babies have lower weight, shorter stature and a small head circumference. Obesity places an additional burden on mothers who have PCOS and their children, said Professor Edza Vanke at NTNU's Department of Clinical and Molecular Medicine. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.